Earlier on this week, we heard from Jake Schaff, who visited Oakland County for a panel Q&A with the Oakland County Sheriff's Office on the issue of fentanyl in our communities. And on Wednesday, the Greater West Bloomfield Community Coalition held a special Q&A discussion on fentanyl in the demonstration kitchen at Henry Ford West Bloomfield Hospital, hearing from experts in medicine, drug misuse intervention and prevention, as well as law enforcement, and tackling this growing issue from a variety of levels across the local area. I had a chance to speak to Dr. Jason Veeder, who is the Vice Chairman of Emergency Medicine across Henry Ford's health system, including West Bloomfield Hospital, who provided some insight on just why fentanyl is so lethal, the primary concerns of medical professionals when it comes to overdoses, as well as how these cases are treated in our local medical systems.
As you know, we've had an opiate crisis for quite a while now. At least people are becoming more and more aware of that. But most often when we have a problem is someone has an unintentional overdose. So someone is using opiates recreationally and then they run into a problem, and that's what we see in the emergency room when people get into trouble using opiates.
What should people know about just how dangerous drugs like fentanyl and other opiates can really be?
Yeah, so, obviously folks that use opiates chronically have different types of problems. What we see in the emergency room is when someone overdoses, then they stop breathing. So that's what an opiate does to you. It depresses your respiratory drive. So when people come in, they've actually arrested and died, and the reversal agent we give them knocks the opiates out of their receptors and allows them to start breathing again. So when you talk about the severity of the problem, when someone overdoses, they really actually can have sudden death. And that's really the core of the problem and why we're fighting it so hard. Narcan, if you give it to someone, it does reverse the effect of opiates, but it doesn't have a bad effect if they haven't used opiates. So there's really no harm in giving Narcan. There are some mild exceptions. I shouldn't say mild stuff. There are exceptions. You'd rather not give it to someone who's pregnant or breastfeeding, but if someone has arrested, you have to worry about just, of course, helping them immediately. So having Narcan around, being able to spot the signs of an opiate overdose, which is generally someone who is kind of stuporous, maybe they have pinpoint pupils, they have blue lips or pale skin, and of course, if shallow breathing or a low heart rate.
Any other advice from the medical standpoint that people should be keeping in mind as they consider this issue and as they learn more about fentanyl and the opioid crisis?
Fentanyl is 50 times more powerful than heroin and 100 times more powerful than morphine. And that's why it's such a crisis, it's such a problem, is that it's so potent, it's cheap, it's easy to mix with other drugs, so people don't know when they're getting it. And when they don't know that they're getting it and it's so powerful, that's when they run into big problems.
And this is a growing concern in our community, not just for medical professionals, but those who are often first on the scene to respond to overdoses or other drug-related incidents. Something that West Bloomfield Police Chief Michael Patton told me is not uncommon here in West Bloomfield. He told me more about our local police's approach to addressing the threats of fentanyl and drug misuse in our community.
Well, I think what you're seeing about the West Bloomfield Police Department's approach is what you're seeing here tonight. An alliance of coalition members and community members, both Henry Ford Hospital, Henry Ford Maple Grove Facility, the West Bloomfield Greater West Bloomfield Community Coalition, the alliance of coalitions in Oakland County here, and other partners that are here to talk about the ongoing and perhaps even increasing risk and threats of fentanyl in our community. Look, substance abuse is a difficult issue. The police are often looking at law enforcement of laws and violations of laws, but that's really not always the best way, because we're never going to arrest our way out of substance abuse issues. We know that the best outcomes are made when we have partnerships like we're talking about tonight to address the issue. So broad spectrum, wide community involvement. This is an educational component tonight to make sure people are aware of what the options are, what services are available here in West Bloomfield and in Oakland County. So I think that's really the best way to approach this. Well, look, law enforcement is already well embedded with both all of our local, county, state, federal partners, and to address law enforcement, the specific law enforcement avenues. But really, it's the broader community partnerships that I think will probably evidence the best outcomes overall. I think we're all doing all the same thing. There's no zip code here in Oakland County that's immune from these issues. We'll talk about some of the numbers that we've experienced here in West Bloomfield. And it's really, I mentioned this before, you've heard me say this before, Tyler, up until the COVID pandemic hit, next to just general old age and dying, The deaths attributed to heroin and fentanyl overdoses and deaths are the second leading cause of death next to old age here in West Bloomfield, and that's pretty significant.
How do you then approach that in terms of training and an intervention when those moments do come where you encounter someone that has overdosed or may be clearly suffering from a substance use issue?
Well, look, overdoses, they ebbs and flows in overdoses. Thankfully, we can report in West Bloomfield the number of deaths have been somewhat reduced, and I think it is because of the proliferation of training, how to use Narcan, getting that out broader in the community. Through our alliance and coalitions here in West Bloomfield, we have distribution boxes of Narcan kits, and we encourage people, even if they don't have a person in the home with substance abuse, that really should be part of their maybe home or business first aid kits, because you just never know when someone's going to collapse. And just like you would do learning how to use CPR or a defibrillator in a heart incident, that perhaps consider learning how to use Narcan and use that, because you never know when someone's going to collapse, and then you too can be a lifesaver.
And that was a key point that these experts made in their discussion and in their Q&A with attendees at last night's panel about fentanyl at Henry Ford West Bloomfield Hospital. This one resource, Narcan, can be a difference maker in life or death for someone who is overdosing. So as Chief Patton said, it suggested that you have some nasal Narcan or other Narcan applications that you can put into your first aid kit. You can keep in your car. You can keep in your purse or in your backpack and bring with you to work. And these experts even talked about some of these resources being a lot more survivable in some of those environments like a hot car over the summer than was previously believed. Experts, including Dr. Veeder and Steve Norris from the Alliance of Coalitions for Healthy Communities, they said that, in fact, it will last and it will work. There's been 10 years plus of studies from the Department of Defense on that say that, look, the worst thing that's going to happen if you have some Narcan in your car, you encounter somebody that maybe is overdosing, is, yes, it's going to be hot, and so it's probably going to burn their nostrils when the nasal Narcan is applied, but is it worse to have a little bit of a burning nostril sensation or to lose your life in the case of that patient? Finally, in the case of repeat drug misuse, treatment options are also available in our community, and Lisa Kaplan from Henry Ford Maple Grove Center spoke to me about the addictive nature of drugs, especially fentanyl, treatment options, and incorporating a community into recovery for drug misuse issues.
Any drug can be addictive. So whether it's fentanyl, alcohol, cocaine, whatever it is, we treat adults ages 18 and up on an inpatient and outpatient basis for whatever substance use disorder they have. So inpatient includes detoxification and residential treatment, and outpatient is intensive outpatient program or individual one-on-one with a therapist.
And a lot of people have this misconception that addiction is a habit that is formed and is a choice that is made by the individuals that suffer from it. But as you mentioned, it's substance misuse that can often lead to substance abuse issues. So how does an organization like yours get to the root of those problems when you see patients come in for opioid addiction or other substance use issues?
Yeah. So a lot of it is education and educating the family as well. This is not a choice. This is a disease. Nobody would choose to have this problem. So because it's a disease, people need medical treatment. And Henry Ford Maple Grove Center is a medical facility. We have doctors and nurses and therapists who help people. So whatever the drug of choice is really doesn't matter. They need education, they need support, they need treatment. And family members do as well because they don't understand it as a disease. As you said, they believe it's a choice, someone making a bad choice. And it goes so far beyond that. We also run on Thursday nights virtually a family education and support group for our Maple Grove families and any family in the community who needs education and support. So ideally, the ideal setup is both the patient and the family get help. It doesn't always work out that way, but that would be ideal.
And then lastly, education opportunities like this, how can they help prepare people for the unfortunate but real possibility that they themselves or somebody in their lives may at some point face a substance use issue?
It is so prevalent that people who are just experimenting or just, buying some other drug off the street may very well be ingesting fentanyl and not even know it, and it can kill them. So the education is so important for the community, for our current patients, for anybody. This is something that could happen to anyone.
And that is a really important note that was made by Lisa Kaplan and by so many other experts on this panel, all of which really said addiction, overdoses, drug misuse, it's not unique to any individual demographic or any risk factors in our community. Anybody can be afflicted with a drug misuse issue, an addiction issue, an overdose, and end up in a life-threatening situation. As Chief Patton said during our discussion and during the panel as well, this issue does not have a zip code. So here are some places that you can go to learn even more information. If you weren't able to attend the panel, if you have more questions, if you want to learn about resources like Narcan, where you can get some Narcan from local Save a Life boxes that are Save Life stations that are placed throughout the greater West Bloomfield community. GWBcoalition.org is the website for the Greater West Bloomfield Community Coalition. Lisa Berkey and the team work with our kids in particular and our parents also on issues of drug abuse and misuse and intervention and prevention efforts, as well as a number of other issues affecting our kids and families in our community. Also, the Alliance of Coalitions for Healthy Communities is a great resource as well, achcmi.org, and that's where you'll be able to find where these Save a Life stations are placed all throughout our communities, including in Greater West Bloomfield. They're located at West Bloomfield Town Hall, at the West Bloomfield Library, both branches, many of our local fire stations, even some places of worship, including Spirit of Grace Church, which is further off in the Lakes area, and in the Tri-Cities location in the Greater West Bloomfield area. Those all have Save a Life stations, and they're all throughout surrounding communities too. achcmi.org and henryford.com, another place you can go for Henry Ford West Bloomfield Hospital resources on this issue and so much more.